Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Bob Raschke. He's a critical care physician, and he's the author of the book, 100 Prayers, God's Answer to Prayer in a COVID ICU. And of note, he did write this under a pseudonym, and we're going to talk about his book today. Bob, welcome to the show.
Thanks so much, Kevin. Thanks for inviting me to be on with you.
So
Appreciate it.
we'll talk about your book in a little bit, but just first off, briefly share your story and journey.
I'm a critical care doc. I've been in practice 38 years, live in the Phoenix metropolitan area, and I teach and do some research, but I'm mostly a critical care physician. And I was raised Catholic, and I've kept my faith private. I'm not church going, but during the COVID pandemic, I had a rebirth of my faith, and that's basically what I wrote about.
All right, so let's talk about that story. And of course, your book is 100 Prayers, God's Answer to Prayer in a COVID ICU. So tell us the story behind the book and tell us why you decided to write it.
Well, one thing I wanted to start with is it's hard to remember now. We're so used to COVID now. It's become like the common cold. But when this story that I've told started in March of 2020, I remember back, it's almost hard to remember how scared we were. We saw this disease exploding across China, exploding across Europe, and then coming to the United States. In March of 2020, when my book started, on March 1st, New York State reported their very first case of COVID. By the end of the month, they had 77,000 cases, and their healthcare system was completely overwhelmed. They were even talking about 2 patients sharing 1 ventilator because, here we are in the greatest nation on earth, the strongest healthcare system on earth is being overwhelmed within 1 month by this disease. So out in Arizona in March of 20, we didn't have N95 masks enough for more than 1 mask per day. Back then, if you guys will remember, it was before the CDC was recommending universal masking. So we were being asked to go into the rooms of patients with pneumonia of unknown origin who were coughing, and we were told we didn't need to wear an N95 mask. So in March of 2020, I was afraid. I was scared for my life. I thought I was going to get COVID. I thought I was going to bring it home to my family. And I was worried for all my coworkers. And I decided to say a prayer a day. I said, I'll say a prayer a day for 100 days. But at the end of the 100 days, it was the middle of July, and Arizona was the hot spot globally. We had the highest attack rate for COVID of any state or country in the world. And it became clear that 100 days of prayer wasn't going to be enough. And so then over the next 2 years, essentially the time that it took the ICU part of the pandemic to resolve, I recorded over 270 prayers, and I prayed by the end, I was praying with every one of my patients every day. And I collected the contemporary stories of what was happening to me and the nurses and my partners, the miracles we were seeing occur that I perceived in my workplace. And I was recording it somewhere along the line in the middle there. I decided, hey, I gotta write this down. This is too important for me. It's the most important event of my professional career, and I need to record it. And so that's when I started to make notes and try to record the history that's recalled in the book.
Now, take us back to those first few months of COVID. And you did mention that there wasn't enough personal protective equipment. You were going into these rooms with pneumonia of unknown origin. People were dying across the country. Did you ever have a thought about just stopping and not going in and protecting yourself and your family? Was there ever that decision point?
No, that never crossed my mind, Kevin, but I know several other doctors and who decided that early on. We had some specialists at our hospital who left our hospital staff when COVID hit there in March of 2020. One of the physicians who stayed behind, he's 72 years old. He took call continuously for 5 months in his specialty. He took call 24 hours a day, 7 days a week for 5 months straight during COVID because the other specialists in his field dropped their privileges when COVID hit. And I asked him one time about it, and he's in the book. I asked him about why he did it, and he said, I just did what anyone would do. Mm. He didn't consider that any special thing that he did.
And you mentioned that you started praying one prayer a day. Go into more detail about the effect that had on you.
You know, the effects, they took a while. I think like anything you do to try to deal with things spiritually, you have to stick with it. And, you know, I don't know at first that a great benefit was apparent to me. But over the course of months and over the course of time, sticking with that, what I found it did for me was I found that it made me more aware of God's presence in my life, in the things that were happening to me had a purpose. The things that I did had a purpose. It was important how I treated a person, even if no one saw me, even if their family couldn't visit, and even if that patient died, the way I treated them was important, that God saw that. In the actions of other people, I could see God guiding other people in their kindness and in their devotion to their job. And it just brought me a great sense of meaning and to my life, and a sense that I was doing the right thing, that it had a purpose. It reminded me why I went into medicine to begin with. I think we spend probably like 70% of our time now doing data entry. Mm-hmm. And that's not why any of us went into medicine. And, you know, my praying to myself and also sharing those prayers with patients was a way of expressing something that was uniquely human, and showed them that I cared. And it showed myself that I cared, which I had to convince myself of, because there were times when your compassion was almost exhausted. We saw over 400 people die in our ICU from COVID pneumonia. And that affects you, and obviously, and you got to cling on. You have to actively cling on to your humanity when you're in a situation like that, or you're going to lose it.
In your ICU, you mentioned that you prayed also with your colleagues and staff. Did you feel that prayer also helped that team pull through the despair of the worst days of COVID?
I hope so, Kevin. I know that. I got to say, when I've asked patients, you know, I always ask their permission if they're conscious, ask their permission to pray. I'd say 99% of the time they are happy that you're going to pray with them. And if anyone's in the room, I invite them, the nurses or respiratory techs, I invite them to pray. And they've universally would hold hands together with me and the patient and pray with us. And if people don't usually tell you what they think about that, but I think that people were deeply moved in most cases. And I think as doctors, we still have a little bit of a hierarchical authority that I feel like it's harder for other people in the healthcare team to do something like praying, because they're afraid, you know, if the doctor doesn't like that. As a doctor, though, as a physician, you are looked to be the leader still to this day. And I think if you're the one that initiates it, other people that are willing will be glad to follow. And it's a long-winded answer, but I think you're right. I think it helped the whole team.
Your book is titled 100 Prayers, God's Answer to Prayer in a COVID ICU. It's noted that this is written under a pseudonym. Now tell us some of the other main messages you want readers to come away with after reading your book.
You know, I think that one of the things I saw was that when you pray, one of the things I learned, I always prayed with two minds. One was the mind of the medical doctor and looking at the prognosis of the patient. And I had the tendency to not want to pray for things that I thought weren't going to happen. One of my friends, this is an account that's in the book. One of my friends caught COVID. He's a nephrologist, and he caught COVID in January of 2021. And he ended up spending 145 days in the ICU. During that time, he had several cardiac arrests. And there were times when I knew scientifically that his chance of surviving was very close to zero. And it dawned on me that if we prayed for his complete recovery, that was a fool's prayer, you know, and that would be unrealistic for us to pray that way. But we decided to pray that way. His wife wanted to pray that way. And I said, I think that's how you're supposed to pray. You're supposed to pray for what you really want. You got to accept God's will. If he doesn't give you 100% what you want, you'll later on we'll understand why that was. But we prayed for my friend for complete recovery. Even after 5 months on the ventilator in a coma, his lungs were completely destroyed, multiple cardiac arrests. We kept praying for a complete recovery. And in his case, he received a double lung transplant 5 months later, and he survived and went home, and he's loving life with his family and his grandkids, and he's traveling again. And so that's one thing I learned is I think, when you're under adversity, go to God. Even if I didn't know much about the Bible. I wasn't even going to church, but I went to God during adversity. And I think that he blessed me greatly for doing that. And I appreciate that. And that's why I wrote the book. It's my testimony and my saying thanks to God for getting me through this and being faithful in hearing our prayers. He listens and he hears and he answers.
Now, for those other physicians who want to incorporate more spirituality into their practice, and it could be the ICU or hospital setting or even the outpatient setting, you said that there was no guidebook for this. The trials of the COVID pandemic made you turn to God. What kind of advice do you have for other clinicians who do want to incorporate more spirituality?
Well, I think one thing is, or some simple things is, I don't try to force it. I actually pray that I'm not using it as a technique. I don't want it to be a technique for rapport. It needs to be a genuine prayer to God. And I think sometimes when you're in someone's room, you get a sense that the timing isn't right. And sometimes you get a sense that the person is struggling. And if the thought pops in your mind to say a prayer with them, I would just recommend that people give it a try. I ask the patient humbly, I just say, hey, would you mind if we said a little prayer together? And they'll almost always say, yeah. Sometimes they'll start crying a little bit and hold their hand and say a prayer with them. I prayed with people who are Christians, Jewish, Muslim, Hindu, traditional Native American religions, probably some people who are agnostic, probably some people just prayed because they thought I wanted to. But you can pray to God. I pray to Jesus, but if the patient is Muslim, I think it's okay for me to pray to God with them. And I'd say, give it a try, see what happens. And I think good things will happen.
So we're speaking now in the end of October 2023. COVID is perceived as being more endemic, and we're certainly a long ways from the worst days in the ICU. Tell me how your experience is, how your trials that you document in your book, how has that changed you as a person and as a physician going forward?
Well, I'm in my early 60s now, so I'm towards the end of my critical care career, and I got to say, it's brought a great sense of meaning to my whole career. It sounds weird to say, but I was grateful to have gotten to be part of this, and it makes me feel like I did something really important at the end of my career. The other thing I realized is, the people I work with, I realized how much I love them, the team. I know all fields of medicine aren't exactly the same, but in critical care, the doctors I can't do anything by myself. I couldn't, if I had to start an IV and hang fluids on an IMED pump, I don't know if I could do it all. The simplest thing, but the team of people I work with, I realized at the end of the pandemic that we had very little turnover on our team. Just about everyone on the team hung in there no matter how bad it got. And that sense of being part of a great team, it went from the nurses even to the house cleaners to the guys in the cafeteria that were feeding us. Everyone was working together to get through this. And I don't know if I really ever realized before in my career how lucky I was to be working with nurses and doctors and the respiratory therapists, all the people we had. You just couldn't have had a better team of people to work with.
We're talking to Bob Raschke. He's a critical care physician. His book, which is written under a pseudonym, is titled 100 Prayers, God's Answer to Prayer in a COVID ICU. Bob, let's end with some take-home messages that you want to leave with the Kevin MD audience.
Well, Kevin, just maybe some of the same things that I said. I would advocate that, one thing that drives me nuts on TV is whenever people get in trouble, whenever they're having fear or anxiety, it's depicted that what you do is you start drinking or something. You go and have a drink. I would say consider under adversity reaching out to God and just try praying to him. Try looking in the Bible a little bit. The Bible will be confusing if you haven't been through it very much, that's as I had not, but things will be revealed to you. And then look for God in your life. Look for him in the people around you and in nature and in the things that happen. And just keep asking for his help and asking for his guidance in your decisions. And I do think in my life, it was very 100% crystal clear to me that he was hearing my prayers and answering them every day. And that's what helped me get through. And I think for physicians nowadays, especially as we get more and more computerized, I think that is going to be a key way for us to maintain our humanism and to show patients that we really care for them. They're not just a computer entry in the EMR. They're a human being that we care about as their physician. I think that's going to really enhance our practice of medicine.
Bob, thank you so much for sharing your story, time, and insight. And thanks again for coming on the show.
Thanks, Kevin.